Welcome to Inova Fair Oaks Hospital and our Bariatric Accredited Comprehensive Center. Our goal is to provide safe and excellent care, and this preoperative education class is one of the ways we meet that goal. As a patient, you have a responsibility to yourself to review the information provided and follow instructions. Always remember to ask questions throughout your surgical preparation process and postoperatively as well. As you prepare for your surgery, there are several tests and procedures that your surgeon may order. These may include ultrasounds, lab work, EKGs, x-rays, and sleep studies. You will also have an interview with the nurse reviewing your medical history and medications that you are currently taking. Sleep studies are ordered for patients to assess for sleep apnea. Sleep apnea is a common disorder in which you have one or more pauses in breathing or shallow breaths while you sleep. The most common type of sleep apnea is obstructive sleep apnea. In this condition, the airway collapses or becomes blocked during sleeping. This causes shallow breathing or breathing pauses. If untreated, sleep apnea may cause high blood pressure, heart attacks, stroke, obesity, and diabetes. It also increases the risk or worsens already existing heart failure. CPAPs are the most common treatment for moderate to severe sleep apnea in adults. The machine gently blows air into your throat. The pressure from the air helps to keep your airway open while you sleep. If you have been prescribed a CPAP as a result of a sleep study, you should be using it for at least 2 weeks prior to your surgery date. This will reduce the risk of having to spend a night in the ICU after surgery. Please bring your CPAP on the day of surgery clean with attachments included. Anesthesia and narcotic pain medications can depress your respirations and make you more prone to postoperative congestion and pneumonia. In order to prevent this, you should use an incentive spirometer 10 times an hour while you're awake. When using the incentive spirometer, make sure to take a deep breath in. Take a break between breaths. Slow, deep breaths help to expand your lungs. The incentive spirometer may trigger you to cough, and that's okay. Coughing will help move secretions that may have collected during surgery. In addition to the incentive spirometer, you can also practice deep breathing exercises. Hug a pillow over your incision, take a deep breath, and cough. Exercise is an important part of your preoperative preparation and recovery. Walking is a great exercise method that can be done before and after surgery. Pedometers are a good way to keep track of steps. The recommendation is 10,000 a day. Once you have been cleared by your surgeon to resume exercising, Inova has several offerings via HealthSource, which can be accessed on the inova.org website. Smoking can cause ulcers, delay the healing process, and increase the risk for pneumonia. Please discontinue smoking prior to surgery. All surgeons have varying policies regarding drinking alcoholic beverages after surgery. The recommendation from the Inova Weight Loss Services team is no alcohol after surgery. There are several reasons for this recommendation. Alcohol contains empty calories. After surgery, we want you to benefit from your calorie intake. Alcohol can also increase the risk for nutritional deficiencies. Also, there is an increased risk for alcoholism after bariatric surgery. Patients after bariatric surgery may become intoxicated faster due to anatomical changes, resulting in a higher blood alcohol level, increasing the risk for liver damage. There is a significant amount of research dedicated to this topic and the risk for cross-addiction. Jacqueline Jacobson is a licensed professional counselor who is part of the Inova Weight Loss Services team. She facilitates support group and sees patients on a one-to-one basis as well. Jacqueline is a great resource for patients who may be experiencing cross-addictions, body image issues, and other concerns prior to and after surgery. Jackie's contact information is found on the team page of your packet. If your surgeon requires you to crush medications after surgery, you will need to change any extended release medications to a form that can be crushed or liquid. The list of medications to stop 2 weeks prior to surgery is located in your packet. If you have questions or concerns regarding these medications, please check with your surgeon and primary care physician. Prior to your surgery, we ask that you use a pre-surgical scrub or antiseptic soap for 3 showers. This means that you would use the soap the morning of and 2 days prior to your surgery. When using the wash, do not use it on your hair or face. Avoid eyes, ears, mouth, and genitals. If you have any soap left over after the 3 showers, please dispose of the soap. You will not be using it after surgery. On the day of surgery, you will enter the hospital through the main entrance, 3600 Joseph Seawick Drive, and proceed to the second floor surgical services desk. On the morning of your surgery, you can use deodorant, but no lotion, makeup, or hair products. Please leave all jewelry at home. You will not be able to wear any into the operating room. If you wear contact lenses, please bring your glasses and their case, since you will not be able to wear contacts in the operating room. At the desk, you will check in and the nurse will take you to the pre-op holding area. Your medical history, including medications that you are currently taking and allergies, will be reviewed. The nurse will start an intravenous drip to give you fluids and medication and may draw any outstanding lab work. The surgeon and anesthesiologist will meet with you and review the plan for the day and answer any questions you may have. You may have up to 2 family members or friends sit with you before you go to the operating room. Once you are taken back for surgery, they will be provided a phone number or pager to check on your progress. Some patients may have a urinary catheter to monitor for dehydration. Your surgeon will let you know if this is the plan for you. Once your surgery is complete, you will spend several hours recovering in the PACU, post-anesthesia care unit, after which you will be transported to the hospital room. Depending on your surgery and the plan your surgeon has discussed with you, most patients have nothing to drink until the morning after surgery. Some patients may have an upper GI study done the morning after surgery to assess for a leak. After reviewing this test, the surgeon will know if you have been cleared for your tray of clear liquids. During the upper GI study, make certain to sip the contrast. Otherwise, your surgeon may review labs and/or an X-ray to assess whether you are ready for your tray of clear liquids. There are several different methods of pain control that can be used after surgery. We will discuss the various options used, and your surgeon will let you know what his plan is for you. You may have a PCA. PCA stands for patient-controlled analgesia. If you have a PCA, you will be given a button to push that will activate a pump to deliver a dose of pain medication through your IV. Safety features are programmed on the machine so that you cannot take too much medication. If you do not have a PCA, you will be given pain medication through your IV as ordered by your surgeon. Your surgeon will transition you to oral pain medications within 1 to 2 days when you are tolerating liquids. Some surgeons may also use what is called an on-cue pump. The on-cue pump is not pain medication. Your on-cue pump will continuously deliver a local anesthetic medication to block the pain in the area of your procedure. The catheter will be placed near the surgical incision site or under the skin next to a nerve near the surgical area. As the medication is delivered, the pump ball will gradually become smaller. The pump is pre-filled, and you will be removing the catheter at home. Your discharge nurse will give you instructions on removal and a number to call for support. Blood clots can form in the legs after surgery if there is decreased movement. Due to this risk, we take several steps to help reduce the likelihood of a clot occurring. In the pre-op area, compression stockings will be provided to you. You will wear these during surgery, and after surgery, compression wraps will be placed on your lower legs when you are sleeping. The wraps are connected to a machine which intermittently pumps on your legs. After surgery, patients will receive an injection of a blood thinner, Lovenox or heparin. Some patients may go home on injectable blood thinners. If this is the case, your surgeon will address this with you, and the hospital staff will provide you education on administering the shots. Even after discharge, for at least 4 weeks, try to get up and walk around every 3 to 4 hours to continue to prevent clots. You may also do ankle circles and foot pumps to help prevent clots. Walking is also a great way to help prevent blood clots. Make sure your first walk is with the staff on the unit. Once you're given the okay by your nurse, you can continue to walk around the unit independently. We recommend walking at least 4 times a day when you're in the hospital after surgery. Walking also helps to relieve the discomfort from gas and bloating. You will need a friend or family member to drive you home after discharge. When you are being discharged, you will receive instructions from both the surgeon and nurse. Please ask questions. You will be provided information on signs of complications and when to call your surgeon.
Welcome to the Inova Fair Oaks Hospital Weight Loss Surgery Pre-Op Review Class Nutrition section. We will be going over lifestyle habits, vitamin and mineral supplements, protein supplements, and tips for planning ahead. Getting ready for surgery. There are many things that you can do to get ready for surgery to make sure that you are successful post-surgery. The first one is chewing your food thoroughly. Remember to eat your meals slowly. It takes 20 to 30 minutes for the stomach to signal the brain that it's full. Start to pay attention to your body so you can recognize the signal to stop eating. Consequences of eating too fast can be nausea, vomiting, or dumping syndrome, which we will talk more about in a few minutes. Eat 3 meals daily. Remember that skipping meals will slow your metabolism. We want you to be in the habit of eating 3 meals every day. Even though you may not have much of an appetite right after surgery, you will still need to eat your meals per your surgeon's dietitian's instructions. Do not eat and drink at the same time. Eating and drinking at the same time can wash the food through your stomach, allowing you to eat more to feel satisfied. This can result in overeating. Eating and drinking at the same time is one of the reasons people regain their weight after surgery. It will also be important to wait the allotted time after you finish eating a meal before resuming your fluid intake. Aim for 64 ounces of fluids daily. Carry a water bottle with you to help ensure you get all you need. You can also practice taking small sips throughout the day pre-surgery. Decrease your intake of caffeine per your surgeon's and dietitian's instructions. These include coffee, black tea, green tea, chocolate, cola-type sodas, and energy drinks. Your surgeon may permit you to drink decaffeinated drinks. Herbal teas do not contain caffeine. Stop drinking carbonated beverages. Consuming any drinks with carbonation may cause pain and discomfort after surgery. Due to the detrimental effects of drinking soda, it is recommended that these drinks not be consumed after surgery. Learn about good nutrition through label reading. Know what you are putting into your body by reading the ingredient list. Visit with your dietitian after surgery as you advance your diet to go over healthy choices. Eliminate refined carbohydrates in your diet because post-surgery, these foods could cause dumping syndrome. This is a reaction that usually occurs as a result of eating something with sugar in it. It could be cake, cookie, or it could be also barbecue sauce or something that has a little sugar in it that you didn't even think about. Eating too fast, eating foods too high in fat, or drinking alcohol can also trigger dumping syndrome. Classic symptoms of dumping syndrome include dizziness, feeling lightheaded, flushing, sweating, nausea, and extreme fatigue. This is most common in patients who have Roux-en-Y gastric bypass surgery. The sugar dumps into your intestine and can cause these symptoms. Organize your kitchen. We have a list of kitchen tools that we will talk about in a few minutes. Preparing ahead will make things easier for you when you get home from the hospital. We want you to purchase your vitamin and mineral and protein supplements ahead of time and have them at home waiting for you when you get home from surgery. You will have a one-on-one appointment with the surgeon's dietitian to go over your specific vitamin and protein needs. Physical activity is an important part of your long-term success, so start thinking about how you can incorporate it into your new lifestyle. Will you need a partner, new equipment, or to join a gym? At Inova Fair Oaks Hospital, we offer a monthly support group for pre- and post-op patients. We also encourage patients to bring support people with them to the group. It is held every third Monday of the month in the lower level conference area of the 3580 building at 6:30 p.m. Support groups are facilitated by a licensed professional counselor and a registered dietitian. You will have an individual appointment with your surgeon's registered dietitian to go over your specific needs, so we are going to talk in generalizations about your vitamin needs. Multivitamin. You want to find a complete multivitamin that contains iron. Read the label carefully. Multivitamins are best absorbed with food in the stomach. Calcium citrate. Calcium citrate is best absorbed by the body. Your body can absorb about 500 milligrams of calcium at a time, so you will need to take 2 to 3 separate doses daily. This will be specified to you during your one-on-one dietitian appointment in the surgeon's office. B12. This needs to be sublingual or under the tongue. You want to look for a 500 microgram dose that you will take every day or 1,000 microgram dose that you will take 3 times a week. Iron. Studies continue to show that Roux-en-Y bypass women patients who are still menstruating do need extra iron. Ferrous sulfate is easier on the stomach. Taking it at bedtime maximizes absorption and lessens the chance of an upset stomach. Additional supplements. Papaya enzyme is a digestive enzyme. As you advance your diet, it may be helpful to have this on hand. If you eat something too fast or it wasn't moist enough and you feel it is stuck in your chest, then you can chew a papaya enzyme and this will help break the food down. Please do not drink when you get that sensation. The food will move through your system as time goes on. Fiber. As you adjust your diet from liquids to mushy foods, you may have some constipation. You can always talk to your surgeon's office and see if they suggest adding fiber. Remember that if you add fiber, you want to ensure that you are drinking plenty of water, as 64 ounces is your daily goal. You can also try to make some of your liquids warm to help move things through your system. Beano. Some people are gassy after having weight loss surgery, and they find that once they are back on regular consistency foods, using Beano is helpful in controlling gas. Biotin. While it hasn't been proven in studies, many patients state that using biotin helps lessen the negative effects on their hair, either thinning or loss. Protein supplements. Even though each surgeon has their own guidelines as to how long and how often they want you to take protein supplements, everyone does need to use one. And the type we suggest is whey protein isolate because that's one of the highest quality proteins and best absorbed. We suggest that it contain 20 to 25 grams of protein per serving and no extra vitamins and minerals, as you will get all you need from your vitamin supplements. If you purchase a powder form, you can mix it with skim milk, soy milk, almond milk, or water. If you use soy or almond milk, please ensure that there are no added sugars. Use a plain versus a flavor. Or you can choose a premixed product that is ready to drink. The biggest tip we can give you is to plan ahead. Try to make your daily life as easy as possible. Do you need little plastic containers to keep food in? A cooler because you're in your car most of the day? A supply of vitamins and protein at work so you don't have to pack those each day? Do you have a blender or something to make your food mushy? Do you have measuring spoons? Having some of these items in your home will make the post-op process much easier. Thank you for your attention, and if you have any questions, you may contact one of the hospital-registered dietitians by using the contact information on this slide. You may also contact your surgeon's office directly.